Pain is a complex, multidimensional experience, especially in patients with chronic or metastatic conditions. Nurses play a crucial role in assessing and managing pain effectively. The best way to start is by asking open-ended questions like, how would you describe your pain? This approach encourages patients to share details about the quality, intensity, and nature of their pain, which is more informative than simply asking about duration or medication use. For example, a patient with metastatic bone cancer may experience breakthrough pain even while on chronic opioid therapy. Recognizing this, nurses should be prepared to offer immediate-release medications for rapid pain relief. Additionally, cognitive therapies such as imagery and hypnosis can help patients manage pain by altering their perception, not by blocking nerve pathways. Understanding these principles ensures that pain management is tailored to each patient's unique experience. When a patient presents with stroke symptoms, time is brain. Nurses must quickly assess airway, breathing, and circulation, followed by a focused neurological evaluation. For example, a sudden severe headache often points to a hemorrhagic stroke, while right-sided paralysis typically indicates a left brain stroke, which can affect language comprehension. Immediate actions include elevating the head of the bed, maintaining adequate hydration, and preparing for rapid diagnostic imaging, such as a non-contrast CT scan. Blood pressure management is nuanced. Elevated pressures may be protective in the acute phase, so antihypertensive therapy is only initiated if levels are critically high. For ischemic strokes within the treatment window, tissue plasminogen activator (TPA) may be administered after ruling out contraindications. Early intervention and understanding the type of stroke are vital for optimizing outcomes and preventing further neurological damage. Chronic neurological disorders like Parkinson's disease, multiple sclerosis, and myasthenia gravis require ongoing individualized nursing care. For Parkinson's, interventions focus on mobility and safety, providing elevated toilet seats, cutting food into small pieces, and using armchairs to assist with transfers. In multiple sclerosis, teaching self-injection techniques and monitoring for medication side effects are essential. Patients with myasthenia gravis benefit from scheduling physically demanding activities early in the day when muscle strength is highest. Nurses must also be vigilant for complications such as respiratory insufficiency in myasthenia gravis or aspiration risk in ALS. For seizure disorders, safety is paramount. Pad side rails, have oxygen and suction available, and document seizure activity thoroughly. These targeted interventions help maintain patient independence, prevent complications, and improve quality of life. Spinal cord injuries present unique challenges, requiring immediate and long-term nursing interventions. In the acute phase, respiratory assessment is the top priority, especially for injuries at or above C5 due to the risk of respiratory compromise. Cardiac monitoring and prevention of complications like autonomic dysreflexia are also essential. As patients transition to rehabilitation, the focus shifts to maximizing independence, teaching self-catheterization for neurogenic bladder, developing bowel programs, and involving both patients and families in care planning. Emotional support is crucial, as patients may experience anger or frustration during recovery. Nurses should encourage input from both patients and caregivers to foster autonomy and prevent unnecessary dependency. By addressing both physical and psychosocial needs, nurses help patients achieve the best possible functional outcomes.